It was Dr. Feliti's California studies that showed that for each adverse childhood experience, such as sexual, physical, or emotional abuse, the death of a parent, the loss of a parent, the jailing of a parent, which we're doing massively in this country, as many people have pointed out. For each of those adverse childhood experiences, the risk of addiction in that child go up exponentially. So that by the time a male child has had 6 of these adverse childhood experiences, his risk of having become a substance-using, injection-dependent addict is 4,600% greater than that of a male child with no such experiences. Again, it's the context we have to understand and the history. So the first question in dealing with addiction is always not why the addiction, but why the pain. But why the pain? I don't have a single female patient in the downtown East Side who was not sexually abused as a child. Not one, not even by accident. I've talked to hundreds. Many of the men were abused, many sexually, if not sexually, then physically in other ways, or emotionally abandoned and neglected and hurt. A policeman who rescued kids from internet pornography. And he's a very humane cop, and he really extends himself to protect these kids. And he says about these children that what's worst about it, he says, is that they're not screaming, just accepting. They have dead eyes. You can tell that their spirit is broken. That's their life. Now the irony, of course, is that going to all the studies, if that cop had transferred to the drug squad, who do you think he'd be chasing in the street? Those same kids that he didn't rescue. In other words, in this society, we punish people for having been abused in the first place and then turning to drugs. Not to mention, of course, that we live in a society that devalues human beings in favor of commodifying everything and everybody, in which people are made to feel insecure, in which people are made to feel that they're inadequate, and in which they're made to feel that they have to complete themselves from the outside. In other words, we live in a society that itself, in its very nature, highly addictive. The very idea of the pursuit of happiness, how can you pursue happiness? As if it was something on the outside of you. That induces an emptiness, it induces a craving for something to be completing you from the outside. In this society, what do we expect? But that many people will turn to addictions to soothe their pain, to soothe their emptiness, to somehow fill the spiritual void in their lives. And this is not a culture that meets people's needs, supports their spirituality or their humanity. That's the context in which we have to understand drug use.